Hello, my dear brothers and sisters. Welcome back to our channel. In this video, we are going to discuss 15 previous year question of MRB Pharmacist. Let's dive into the first question. Net profit is answer is okay. Four choices are there: debited to capital account, B is credited to capital account, debited to drawing account, and credited to drawing account. The answer is second question. In which of the following statement the figures are the converted into percentage to some common base? Choice A. Funds flow analysis. B. Common size financial statement. C. Ratio analysis. D. Comparative financial statement. The answer is common size financial statement. Question number 3. Outpatient clinic service are provided in a hospital by choice A clinical service, B administrative services, B C ambulatory services, D housekeeping services. The answer is ambulatory services. The question number 4. Registered pharmacists are required for choice A is medical stores, B quality control department, C dispensing of drugs, and all of the above. The answer is all of the above. Question number 5. Satellite pharmacies are A. Centralized unit dose dispensing system, decentralized unit dose dispensing system, central sterile supply unit, mobile dispensing unit. The answer is decentralized unit dose dispensing system. Sixth question is Belladonna blaster is applied for rheumatism A. B is sprains and strains. C. Absorb wound exudes. D. Wound dressing. The answer is sprains and strains. The question number 7 is pathophysiology means A. Study of disease, B. Physiological changes during disease condition, C. Development of disease, D. Structural changes produced during disease. The answer is study of disease. Question number 8. Normal eosinophil count is A is 2 to 6%, B is 1 to 4%, C is 0.1%, D is 7 to 10%. The answer is 1 to 4%. Question number 9. Ray syndrome is related to A. Phenytoin, B. Heparin, C. Theophylline, D. Acetyl salicylic acid, which is called aspirin. The answer is acetyl salicylic acid. The question number 10. Choose the correct drug which causes the genetically determined abnormality reactivity, which is called idiosyncrasy. A. Barbiturate, B. Triflopromazine, C. Lithium, D. Atropine. The answer is lithium. Question number 11. Dissociative anesthesia is produced by A. Ketamine. B. Fentanyl. C. Propofol. D. Sulfurate. The answer is ketamine. The 12th question. Therapeutic index is ED50 minus LD50. B. ED50 int LD50. LD50 divided by ED50. D. ED50 divided by LD50. The answer is ED50 divided by LD50. This is a correct answer. Question number 13. Amalizumab act by neutralization of immunoglobulin E, antagonism of release of mediators, blockade of the constrictor neurotransmitter, D. Mimicking dilator neurotransmitter. The answer is neutralization of immunoglobulin E. The question number 14. Beta histine is the A. H1 selective histamine analog, H2 selective histaminergic antagonist, C. H receptor blocker, D. Beta receptor blocker. The answer is H1 selective histamine analog. The fifth question is select the diuretic that can cause gynecomastia and menstrual irregularities as the adverse effect on high dose. A. Amiloride, B. Spironolactone, and C. Metalazone, and D. Acetazolamide. The answer is I don't know that. So, if you know this answer, please comment your answer in the comment section. And இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்துச்சு அப்படின்னா லைக் பண்ணுங்க. And also, who are preparing for the MRB Pharmacist 2025, share this video and like this video and subscribe this YouTube channel. Thank you guys. We will meet in next video.